she's so fine. Hell of a blows my mind. Hell of a lights my day.
What's good, guys? This story came out yesterday, Monday the 29th. And again, thanks to Marie722 for sending it to me. CDC director fights back tears as she warns of soaring COVID-19 cases. Right now, I'm scared. Rochelle Walensky, the new director of the Centers for Disease Control and Prevention, fought back tears on Monday as she warned that a fourth surge in COVID-19 cases could be on the way. Right now, I'm scared, Walensky said during the White House COVID-19 press briefing, citing troubling trends in new coronavirus cases, hospitalizations, and deaths across the U.S. The country's daily coronavirus cases peaked in early January at more than 315,000, then dropped steadily through mid-March. But average daily cases have risen by about 15% in the past 2 weeks, and average weekly hospitalizations have increased by 5%, even as vaccinations ramp up. 28 states have seen an uptick in daily cases over the past few weeks. Michigan's average weekly cases increased almost fourfold in 5 weeks, while New York's average weekly case rose by 42% in 2 weeks. U.S. deaths are still trending down overall, but rises typically appear in at least 3 weeks after rises in cases. An increase in hospitalizations is usually a sign that deaths will follow. At least 8 states have already seen daily deaths increase in the past 2 weeks. I'm asking you to just hold on a little longer, to get vaccinated when you can, so that all of those people that we all love will still be here when this pandemic ends, Walensky said. That is a picture of the refrigerated trailers used to store bodies at a temporary morgue in Brooklyn, New York on May the 13th. And that was a rough sight. I remember seeing that for the first time and it was just... Walensky described the recurring feeling I have of impending doom when looking at the nation's COVID-19 case numbers lately. I'm speaking today not necessarily as your CDC director, not only as your CDC director, but as a wife, as a mother, as a daughter, to ask you to just hold on a little while longer, she said. I so badly want to be done. I know you all so badly want to be done. We are just almost there, but not quite yet. Some experts think that as the 3 authorized COVID-19 vaccines become widely available, Americans are getting the false impression that it's safe to dine indoors, go to bars, or attend large gatherings, whether or not they're fully vaccinated. Several states, including Texas and Georgia, have already eliminated capacity restrictions for restaurants and bars. At least 16 states no longer have mask requirements. For the health of our country, we must work together now to prevent a fourth surge, Walensky said. At the briefing on Monday, Dr. Anthony Fauci, President Joe Biden's chief medical advisor, attributed the recent increase in U.S. cases to the nation, quote, really doing things prematurely right now with regard to opening up, end quote. In an interview with CBS's Face the Nation on Sunday, Fauci also attributed rising cases to the spread of new, more virulent coronavirus strains. The U.S. has identified more than 10,000 cases of the B.1.1.7 variant, first detected in the UK since December. Studies have found that B.1.1.7 is 50% to 70% more contagious than its predecessors, and the CDC says B.1.1.7 now accounts for roughly 26% of sequenced virus nationwide. Walensky reminded Americans that we are not powerless against the virus. She encouraged everyone to continue masking, distancing, washing their hands, and staying home. Roughly a third of the country's adults have had at least one vaccine dose, and emerging evidence suggests the vaccines reduce coronavirus transmission, in addition to blunting severe COVID-19 symptoms. But more transmissible variants mean the virus is probably less forgiving when people don't take precautions, Walensky said. I know what it's like as a physician to stand in that patient room, gowned, gloved, masked, shielded, and to be the last person to touch someone else's loved one, she said. I know what it's like to pull up to your hospital every day and see the extra morgues sitting outside. To take her CDC role, Walensky stepped down as the chief of infectious diseases at Massachusetts General Hospital roughly 2 months ago, as the pandemic was killing thousands of Americans every day. I was just actually discussing this with someone today, as a matter of fact. And speaking of COVID, I know you will hear my voice go in and out because I keep having this cough ever since I contracted COVID, and I just can't get rid of it. And it's a deep cough. But it is very scary. With that B117 variant, it is very scary. I've done a story on the Chicago cases with the B117. It's just very scary right now. It is too soon to pull those masks off. That's just my personal opinion. I don't care where I go. I have my mask on. I have my hand sanitizer. Nothing has changed for me. This has been going on almost a year. Or a little over a year, actually. Nothing has changed. So, I mean, it's just part of my routine now. I'm going to end this story on that note. But thanks for watching, guys.